Hello everyone, my name is Dr.Dharav. I am Neuro and Vascular Interventional Radiologist. In today's video, we are going to see about brain aneurysm coiling case, which is a live case, but obviously recorded case. So this particular patient is an old man who is having a severe headache since last 5 days. He went to some local doctors and medicines were given, but not responding to medicine. So he finally come to our hospital and admitted in the emergency medicine department, and then they did a CT scan there, and then he found to have a brain hemorrhage, and that's how the brain aneurysm was detected. So let's see this case step by step and how we have treated with the coiling. CT scan was done which showed brain hemorrhage or subarachnoid hemorrhage. CT angiography was done which showed brain aneurysm in one of the blood vessels. Patient was taken for coiling in the cath lab under X-ray guidance. Under general anesthesia, a small tube is inserted into right femoral artery, which is a vessel running in the thigh. This is a pinhole access. You can see a green tube here. All the coiling, all the procedure is done through this small tube. There is no cut, no stitches, no suture, nothing. Entire procedure will be done through this small tube. Angiography done which showed brain aneurysm as shown in the arrow. Now 3D angiography was done to know the best view of the brain aneurysm. Guiding tube is taken into the blood vessel which is having brain aneurysm. Through this guiding tube, smaller tube will be taken to insert coil. The first balloon is kept across the neck of the aneurysm to prevent bleeding if happens during the coiling. Now small tube is carefully taken inside the aneurysm over the micro wire. Through this small tube, we are going to insert the coils inside the aneurysm. Very gently we need to take this tube. Now the first coil is inserted inside the aneurysm. Size of the coil is decided after measuring the size of the aneurysm. So under X-ray guidance, you see the first coil is being inserted into the aneurysm. Entire coil is carefully, slowly inserted into the aneurysm. So angiography is done after first coil to see all is well, and once it's decided that everything is fine, coil is inside aneurysm, this coil can be detached from its wire. There is special detacher is available. So this coil is detached from its wire electrolytically, and then coil wire is taken out of that tube. Tube is still inside the aneurysm. Now we'll take a second coil through the same tube and tightly pack the aneurysm. So few more coils are inserted, same way to tightly pack the aneurysm under X-ray guidance. Angiography done which showed aneurysm is completely blocked by coils and no blood is going inside the aneurysm. So once you are satisfied that coiling is adequate, you can take out the small tube from the aneurysm gently, not to disturb any coils. And finally, all tubes are taken out. Compression dressing is applied at the entry site. There is no stitches, no scar. So you have seen that's how we have treated this patient with the coiling. Depending upon the severity of initial hemorrhage and initial condition of the patient will remain in hospital for a few days, and then patient can go home once he recovered fully. and generally this patient requires some follow-up angiography also. So generally we do it after 6 months. So that's all about brain aneurysm coiling. It's a minimally invasive technique. Without open surgery, we can treat this deadly disease by endovascular interventional radiology means. Thank you for watching.